Hi everyone, Dr. Nemechek here. I want to talk to you about feeling lightheaded. What do I mean by that? Some people just say dizzy, okay? But stand up, you get out of a chair, just standing still too long, and you get this swooning kind of feeling, a little disoriented maybe. Some people may even go a little dark, their vision gets a little funny, and then it will pass. What's happening is so here's this orange pen, that's your head, the orange part. When you stand up, your body has to push up against the forces of gravity. Your nervous system does this. And you need to it needs to do this so you get proper pressure in the brain, and so that the oxygen that's carried in your red blood cells, you breathe, you fill them up with oxygen. You got to push them at the right pressure so that oxygen can flow into your brain. All right? And if you have an injury there and you stand up, that pressure dips and you're like, whoa. Now, some other medical problems can cause this. Severe anemia, some severe electrolyte problems or kidney problems where it's not filtering correctly, a heart rhythm problem. If you're experiencing this, you need to get checked by your doctor. They'll go through a couple things, say, no, everything looks fine. And they'll say, don't worry about it. And they're saying that because they don't know what to do about it, okay? The real point here is, and where do these injuries come from? This from injuries causes this. They're little relatively minor things, or they could be a full-on concussion. They come from inflammation, so that could be from a surgery or a fracture. Vaccines can do it. COVID really does it. Or severe emotional traumas will actually injure your nervous system, okay? If you don't have inflammation in your body and your brain, abnormal, unhealthy inflammation, you would fully recover. If you don't recover, you have abnormal and unhealthy inflammation in your body. We got to get that fixed. Even if you think, well, these symptoms aren't that bad, what's happening is all day long, even though you get that little dip, your pressure's low all day and your brain's not getting enough oxygen. That's why you can't focus well. That's why you can't concentrate. That's why you got brain fog. It makes people anxious, makes people fidgety. It makes you crave salt and sugar. It makes you thirsty all the time, makes you crave nicotine, causes anxiety, causes headaches, neck pain. It's a big deal. A lot of symptoms from this one problem. And to make matters worse, the inflammation that's preventing you from recovering is the same inflammation that triggers cancer, like colon cancer and breast cancer. They're triggered by inflammation. It causes heart disease, diabetes, autoimmune disorders, whole chronic depression. The inflammation is wiping everybody out. And if you have this little lightheadedness or dizziness, you have this too. All right? You can stop it. That's what we do. We learned over the last 20 years how to reduce inflammation enough, your brain will repair itself. Even decades later, this can be repaired. And if your nervous system recovers and your brain's feeling better and you don't have lightheadedness, you know what? You don't have inflammation that's going to trigger breast cancer, for instance. All right? That's a pretty good thing to know. So, if your doctor can't help you, watch the videos, try to do what I do. If not, a lot of people around the country, they hop on a plane, they come to Arizona for a day, bada bing, we set everything up, and then we just do follow-up Skypes for, up to 18 months. Usually most people don't need to work with us for more than a year. And they're like, great. All right? I hope that's helpful to everybody. Otherwise, have a great afternoon. Bye.